Okay, it's the day before surgery. Of course, I'm nervous. Getting mitral valve surgery for a fibroelastoma. That is tomorrow. I have to be there at 5:30 a.m. Surgery's supposed to be at 7 o'clock. And they said it's going to take about 3 hours. But what I want to go over is, just in case anybody else has to go through this, some of the processes, some of the things that you might need to expect. In my case, what they said was, again, because it's, valve surgery, they said there's three possible approaches. The first approach is they can either go full sternum, they can go partial sternum, which means the bottom portion of your sternum, the very, the middle of your chest, but maybe near the bottom if you want to have less of a scar, or they can go through the rib cage somewhere in the bottom, like for the girls, under the breast, under the boobs. This way there's less of a scar. There's pros and cons to both. If you go through the sternum, there is a longer healing time, especially if it's full sternum. It is a lot longer healing time. It could be 8 to 12 weeks. A lot longer if you do a lot of lifting at work, if you do a lot of, things, heavy type work. Especially when I used to be an EMT, that would have had me out a whole lot longer because obviously I would have been lifting. Unless, they decided to throw me in dispatch where I could just sit and, do something else if they had some kind of light duty work. But if you do a lot of lifting, if you're doing warehouse work, if you're doing, any kind of physical labor, your construction, whatever, you're gonna be out a lot longer. If you're doing full sternum, even if you're doing partial sternum, it's gonna be a lot longer. If they go through the rib cage, it's gonna be a little bit shorter healing, but it's still gonna be, a long time. Some doctors may still put you out for 8 to 12 weeks, but again, it depends on what you do, what kind of work you do, how active you are. Other things to consider about the different approaches, and this is what the doctors were telling me during the pre-admission testing. If they go through the full sternum, the bypass part is a little bit easier, obviously, because all the access is right there. If they go through the rib cage, what happens is when they go through the rib cage, they also have to go through a catheter in the groin to go and help bypass the heart, which means they have to run tubes up through your arteries or your through your arteries up into your heart to help do the bypass part. After considering that, I'm not so worried about the scar. I don't care. I'll wear my scar with pride. I have no problem with that. I'm almost 50 years old. I just celebrated my 49th birthday yesterday. So guess what? Even if I hit goal weight, I'm not exactly like a bikini person. I don't care. You can do a full, you can do a partial if it's easier for the doctors. My mindset, but this is for me. Other people still might not want the scar. But my mindset is whatever's easier for the surgeons. If it's easier for the surgeons to go through the sternum, so be it. But we'll see. They said they're going to make the final determination once I'm on the table. So I'll wake up and I'll find out where my scar, where my incisions are. Could be here. Could be here. Like I said, it could be the full. It could be a nice big incision. It could be a smaller incision. It depends on what they think they need to do. So just go into it. If you have to get the surgery, just go into it with that mindset that, you may have to make that decision. Are you willing to have the scar here to make their approach easier? Or do you want to have less of a scar, but knowing that they're also going to have to do a groin cath to go up and in so that they can bypass the heart while they're doing the surgery. So, which does make things a little bit more difficult. And also the other thing too, for the girls, if they go in under here, there is a possibility that you will get numbness in the breast. So that's another thing to consider. Again, I'm at the age, I don't care if I have a scar. So be it. My husband's good. He's fine. I'm sure he'd rather, me be okay. He's more interested in me being okay than whether or not I have a scar. So he's just right now very, on edge because he's just worried about me. So he doesn't care where my scar is as long as I'm okay. So as long as you have a supportive family, then the decision really is on you. where the approach is, between you and your surgeon. The other thing, you're going to also need to pack before you go, because you're going to be in there anywhere from 4 to 7 days, depending on the approach and how quickly you get up and about, because they are going to get you up and about. I'm going to bring this with me, and I'm going to hopefully, update while I'm in there, but they are going to get you up and about while you're in there. So, but you're going to want to pack, deodorant. You're going to want to pack. They give me actually a little list. They gave me a little book, which somewhere around here, I'll have to find it. Actually, it might be back. Nope. Sorry. But I'll have to find it. But it'll give you a little list. You want deodorant, you want your toothbrush, electric razors, little things like that. If you're worried about bringing, they tell you not to bring anything valuable. They tell you not to bring anything like phones or anything like that. However, you can always call your hospital and find out what the protocol is as far as where your stuff is going to be stored, how it's going to get to you, or you can give it to your family to have it sent to you later. Now with COVID, nobody's visiting, especially right now during the code red. A lot of these hospitals, including mine, there's a code red, so there are no visitors at all. So, but I talked to security in my hospital. Luckily, I work at the hospital that I'm at, so it's a lot easier. And they said, no problem, you just pack in your bag, because it stays in their office until it goes up to you. So that's what I'm doing, is I'm packing it. But I checked with them first. And you do have the right to do that. You can call, and even call the security office, and call the hospital, call the security office. Hey, I'm having inpatient surgery. I'm coming in for an inpatient stay. I'm having surgery. Look, if I pack this, this, and this, is it going to be okay, until it comes up to my room? They'll tell you. Don't worry about it. You have that right to ask them. There's a thing called a patient bill of rights, but there are certain things they don't put on that bill of rights. But you do have the right to call and ask as to, what you can bring, what you can ask about. So don't feel weird doing it. Call and ask. You do have that right to ask. Do it. Okay? Don't forget, I work in a hospital. I know these things. So call and ask if you can bring certain things. If not, have your family bring it later. And there's usually protocols about getting it up to you. Like where I work, you bring it to where the screening process is, you leave it there, and then they call the floor. The floor comes down, gets it, and brings it up to you. You usually label it or whatever. So my family's already got we already got the little, fire drill down on how to get anything to me, so that I have things to do while I'm there. When they're not bugging me with vital signs and medications and therapy and all this other stuff, and I'm not sleeping. I already have my little thing of, stuff I'm going to pack later once I'm ready, because I'm only taking a half day today. So this way I can come home, I can pack, I can relax, because I want some downtime before I have to get ready. And the other thing you're going to have to be prepared for is, most likely, because most surgeries, anything, especially open heart, what they're going to have you do is they're going to have you take an antiseptic shower the night before. You're going to have on clean, sleepwear, pajamas, t-shirts, whatever you wear to bed. If you wear nothing, great, you don't have to worry about it. But I would have also a clean towel. If you use a robe, wash your robe. Whatever you use, and then you also are supposed to have clean sheets that night. So if you have a clean set of sheets ready, get them ready, because you're going to need them for that night. So get that ready, and then this way you'll be prepared. That's why too I want today off, because I just want to not today off, but at least a half day, so this way I can wash my favorite towel, wash my robe. And I already have my pajamas set. I have a little bag that I'm going to pack later. And this way I can have some downtime with my family and just relax. And this way I don't have to, think too much. And if you feel anxious and you're feeling, because believe me, I've been feeling extremely anxious. I even asked my doctor for something, and he gave me a little script. This way I can try, some anti-anxieties. This way I can take it when I need it, and I've just been taking it at night to help me sleep, just so I can get some good sleep before this. So, and because that's very important, you want to make sure you're well rested. You want to make sure you're eating good, you're sleeping good, and not to get too freaked out, because it is major surgery. They are doing, major surgery, but it's common surgery, and just keep that in mind. It's not saying I'm not anxious. It might not look like I'm not anxious. Of course I am. I'm human. And just because I work for a hospital doesn't mean I'm not nervous too. I am. I'm extremely nervous, but I'm trying not to be. I'm trying to just, go through the motions, and talking to you guys about it actually helps me a bit, because explaining it to you actually helps me feel a little bit better about it. So that's another reason I'm doing this video. Even if only one person watches it, please, and get something out of it, I'm happy. But just remember, you want to pack your bag, you want to get everything ready, have your clean sheets, clean linens, clean towel. They'll give you your antiseptic soap after your pre-admission testing. And just make sure too, you have confidence in your team. You want to make sure that when they come and talk to you in your pre-admission testing and they meet with you, you want to have confidence in that team. Don't forget to ask them anything at all. You ask them, and they'll answer you, and they should answer you. And if they don't have the answer, then they need to get back to you. Well, they should have the answers, because but if you ask them something completely unusual, they should at least be able to get back to you on it. So just don't be afraid to answer, ask questions, because that's the time to do it. You don't want to be doing it the morning of and having any unanswered questions. Ask questions. It's this way you have confidence in your team, the team that's going to be working on you. Alright? So if you have any questions, if you have any concerns, leave comments, and I will, do my best to get back to you. Thank you for listening, and if you like it, please subscribe. And don't have any subscribers yet, but hey, who knows? Maybe somebody will actually like it and subscribe. I'll try and do more if I see people like it. Alright? Have a great day.